Interventional pain management is a way that we can treat patients without just using medications. The best way to treat patients is to use a multidisciplinary approach. And so that includes many things. That includes medications, physical therapy, chiropractic care, acupuncture, yoga, massage, and all of those different things. But what I add to that picture is different types of injections or different types of procedures. I usually use image-guided techniques using x-rays or ultrasound to put needles where they need to be and put medicine or other types of treatments to help alleviate pain. We have surgeons that are orthopedists that work on shoulders and knees and hips. We have neurosurgeons like Dr. Justice and Dr. Dramakowitz can treat anywhere from the brain to anywhere in the spine, the neck and the low back. Additionally, we have sports medicine physicians that can evaluate you and treat any of your sport injuries that you might have. And I can work with any of the chronic pain issues that you might be dealing with. And so it can end up kind of being a one-stop shop. Procedures that have been coming out and been advancing in the last 5 to 10 years include spinal cord stimulation, where we put a small stimulator that goes into the back that sends little impulses to the spinal cord that can modulate or change the way that people feel pain. There are more advanced treatments for spinal stenosis, where we can put little spacers in between the bones of the spine to reduce pressure from the spinal stenosis. There are also peripheral nerve stimulators, so we can put, again, use the ultrasound guidance or image guidance to put little wires next to nerves and send little pulsing signals to those nerves to help to reduce pain. I initially went to physical therapy school. I got my master's in physical therapy from Idaho State University. With the support of my wife and family, we kind of jumped ship and started over again and went to Texas A&M for medical school and stayed there as well for a residency in anesthesiology. Did a fellowship in pain management at the University of Utah. After that, we decided to take a jump across the Mississippi and ended up in Tennessee. And so we were looking for something that was not as hot as Texas and not as cold as Idaho and had a lot of trees. And so here we are. What we really like about this area, again, is that we love the trees. We love the rolling hills and the outdoor activities. We like to hike and camp and fish, and we love the people. We love the kind of southern charm of a small town and the people that are friendly and nice. It comes back again to helping patients. If I can do an injection or do some sort of treatment and somebody comes back to me and says, I was able to go for a hike, or I was able to go to the grocery store, I was able to play with my grandkids, that's what brings me satisfaction. When I first interviewed with the partners at Tier 1, and they wanted somebody that's going to come in and be part of the community and help take care of their cousins and their aunts and their uncles and their neighbors, and they really care about Cookeville.